The next one is systemic lupus erythematosus. SLE is a disease that's a great masquerader. It's a multi-organ disease, has multiple manifestations. It is an autoimmune disease, probably multifactorial, but we don't know what exactly causes it. We do know that there are autoantibodies. There are some HLA associations, a lot of overwhelming evidence towards autoimmunity. It is exacerbated by sunlight, and also you have some forms of lupus that are drug-induced, and those are some of the drugs that can cause a lupus-like syndrome. It is much more common in females than in males. You need to remember that. And frequently they'll present with fever, fatigue, arthralgias, arthritis, and rash. The rash can even be a vasculitic rash. The skin manifestations include a malar rash. They talk about that butterfly rash on the cheeks. They can also have discoid lesions and vascular lesions on the hands and feet. And they can have a Raynaud's phenomenon where they have vasospasm and they go through all the different color changes. Renal manifestations are very common in children, and they can include glomerulonephritis and can actually progress to renal failure. There's a whole list of different organ systems that are affected by lupus. Cardiovascular, all the tissues. If they mention the word Liebman-Sachs endocarditis, you should think of lupus right away. They can also have serositis. Neurologic problems include encephalopathies and seizures. Pulmonary problems include pleuritic type pain. They will have anemia as a hematologic manifestation. They would also have abdominal pain, vasculitis. This is the typical rash that you can see on the face, and this is a rash that is actually worse on sun exposure. These are the oral ulcers that you see sometimes with lupus. And these are the criteria. It is a disease that is a diagnosis of exclusion, and these are the actual criteria which make up a nice mnemonic, M.D. Sopenhair, if you read the letters down. So they can have, you need 4 out of 11 of these to be able to make the diagnosis. They can have a malar rash, a discoid rash, serositis, oral ulcers. They are ANA positive. They can have photosensitivity. They have neurologic complications as well as hematologic complications, arthritis. It's an immune disorder, and they have renal complications. So that you need 4 out of those to be able to make the diagnosis. The best screening test, sounds like a test question, the best screening test is the ANA, and that's a great one to start with. The best test overall is the anti-double-stranded DNA. The problem with this one is it's reliable, but it's only elevated during active disease. So it's not the best screening test, that would be the ANA, but the best overall test is the anti-double-stranded DNA. And there you also have other tests that may be useful, but think of those first 2 for the exam. The management of lupus, you can use non-steroidals if there's no renal involvement. If there's renal involvement, you have to go with other pain management. For mild disease, you can use hydroxychloroquine. Some patients will have hypercoagulable states, and so they need to be on anticoagulants. Corticosteroids are a mainstay of treatment here with this disease, particularly for kidneys, and chemotherapy is being used, such as cyclophosphamide, for immune suppression, basically. There is one other condition with lupus, and it's called neonatal lupus. This is transfer autoantibodies across the placenta. These babies can have cutaneous lesions, hepatitis, thrombocytopenia. The main thing to remember about neonatal lupus is they can have heart block. This is a congenital heart block. It does not go away, and sometimes these babies, if it does not improve or if it's severe enough of a heart block, they are going to require pacing.